Now we will discuss immunization in this pandemic era. Uh, as a physician, we have to understand the basis of the immunology, the basis of the general principles of vaccinations, antigen, antibodies, and innate, adaptive, because there will be a lot of people who keep on seeing you and keep on asking a lot of questions like, hey doc, shall I need some vaccination or not, and a lot of stuff. So that's why you have to understand the basic principle in order to cope up these all the difficulties and these all the in order to answer those questions. So in immunization, we have the four categories of immunization: live attenuated, then killed or inactivated, subunit, and toxoid. And one by one, we will discuss them. So first one is live attenuated vaccines. So live means that the vaccination or the organism or the thing, whatever the thing present in that vaccination is live, means it has the ability to produce a response, a humoral or a cellular response. Attenuated means that its virulence, or its the ability of the vaccine, the ability of the pathogen which is present in the vaccine is weakened. So live means it can generate humoral and cellular response, and attenuated means it loses its pathogenicity, and it loses its pathogenicity. It means it is harmless, it is weakened. So a weakened virus can cause a humoral or a cellular response in our body in order to attain a immune response. So those vaccinations are known as live attenuated vaccinations. Their pros are, what are the pros? So the pros of these vaccinations, that they have a strong long-term immunity. They give us a long-term immunity, and they uh, they have a con. Once once the pathogen attains its virulence, it can revert into its virulence form. So there is a also a risk, and versus there is also a benefit. So this is a game of benefit versus the risk. So the con is they revert their virulence, they loses their pathogenicity, but after some inoculation period, the pathogen can attain or revert their virulence form. So some other notes over here, that we have to contraindicated live vaccine in the pregnant females and in immunocompromised. So pregnant and immunocompromised. There is an exception of MMR and varicella VZV or varicella vaccine. Uh, we have to vaccinate an HIV patient, HIV patient, although it is under the heading of immunocompromised. But if an HIV patient have the CD cell, CD4 cells of 200 or greater, then we can give the MMR or varicella vaccine to them. Otherwise, immunocompromised are contraindicated. After which, we have to name the live attenuated vaccinations. So there is a mnemonic in the first aid, that is attention, attention for the adenovirus or the adenovirus vaccination. Attention teachers, please vaccinate the young, beautiful infants MMR regularly. So A for attention, and for the attention adenovirus, there is a note over here for the military recruits, we have to give them non-attenuated adenovirus vaccine. Why? Because in the military they have to live in different barricades, in different camps, where in a short place or in a small room there have been there were a lot of militants or military army over there. So in a small room they have to live a lot of people over, they have to accommodate a lot of people. So that's why if you give a attenuated vaccine, they revert their virulence form much easily, because in a barricade a military soldier have to live for a lot of days, for a lot of weeks. So in those weeks, if he got a attenuated shot of vaccine, then after some time the vaccine the adenovirus, the virus get reverted from its reverted to its virulence form, and can cause epidemic of epidemic of adenoviral infection in that whole barricade, and he can infect a lot of military soldiers. So that's why they have to give non-attenuated vaccine, so that they can attain a long-term protection from that adenovirus. So attention teachers, for T we have typhoid and oral typhoid. Attention teachers, please, P for polio and sabine. Attention teacher, please vaccinate for varicella, chickenpox. Please vaccinate beautiful for BCG, young for yellow fever, beautiful young infants for influenza, intranasal dose, MMR for MMR, measles, mumps and rubella, and then regularly for rotavirus, for gastroenteritis. So these are all the vaccines of live attenuated heading. And simply, like level 1 question in our USMLE, they can ask you this vaccine, and it can generate this response, or this vaccine belong to this. So that's why you have to consider these vaccination thoroughly, but you have to understand these vaccinations in this pandemic era or pandemic period. So after live attenuated vaccine, now we discuss the killed and make them inactivated vaccines. So killed by chemicals or heat, and kill them all except kill and make them inactivated except their epitope. And in our antibody lecture we have discussed that the epitope is present on the epitope binds to the FAB portion of the antigen binding portion of the immunoglobulin. So intact epitope, but rest of the virus is damaged by chemical or heat. So epitope can induce a humoral response. So humoral response, it means it is much safer than the live attenuated, safer. So this is the pro, but it is humoral, so it is a weaker vaccine than live attenuated vaccine. So this is the pro of that, it is safer than live attenuated vaccine, and the con is it is weaker and require boosters. So this is the con. So humoral response and then chemical denaturation, etc., etc. After which we know that a a trip, A mean hepatitis, a trip, T for typhoid. Again, it is present in first aid. A trip, typhoid, but this typhoid is intramuscular, intramuscular one, typhoid. So a trip, R for rabies. A trip, I, influenza, again. Trip, P for polio, and this polio is Salk one. A trip, a trip to somewhere, a trip to Wuhan can a trip to any epidemic area can cause you coronavirus, COVID-19. Sorry, so I don't be racist or I'm not anti Asian, so that's why I don't manage Wuhan, or I don't target those audience. Sorry about that. So a trip to any epidemic area can cause you disease. So a trip, TRIP, can kill you or can cause disease. So this is all about uh, the killed or inactivated vaccines. Then we have subunit subunit type of vaccines. So in subunit category, we have only antigen left. For all the virus, we just need that antigen and destroy all of its structure in order to generate immune response. So this antigen can best generate immune generate immunity. So in the subunit category, we have it's very much its con is it's expensive, but the pro is it has low side effects. So it's expensive, and it also we need boosters. So in the subunit category, we have first one is human papilloma virus, 6, 11, 16, 18, all those. Then we have hepatitis B, antigen. Okay. Then we have acellular pertussis, whooping cough, human papilloma virus, hepatitis B, pertussis, HIV, human influenza, Haemophilus influenza type B, then strep pneumo, and HIV. Then we have Neisseria. If we see all these things, then we notice something, that these all are very much important bacteria and viruses. Like human papilloma virus, yes, it can cause papillomatis disease or cancers. Then we have hepatitis B, cirrhosis, hepatitis, then pertussis, whooping cough. Then we have human influenza B virus, B bacteria. It can cause a lot of things. Strep pneumo, meningitis, pneumonia, Neisseria, meningitis, venerea. So strep subunit vaccines, these are the subunit vaccine, and we need a lot of boosters and a lot of boosters in order to get immune against these viruses or pathogens. So next we have the toxoid, and this is very much interesting. Toxoid vaccine, we have diphtheria, Corneum, bacterium, diphtheria, and tetanus. So diphtheria and tetanus. So these two are just two examples. So diphtheria and tetanus, they protect. What is the pro? Protect from the toxins, toxoid toxins. And what is the con? Con is again, we need boosters. Whenever we have a road accident on the road, we need tetanus shot. So that's why we need boosters. So it's a description or notes that how a toxoid can form. Then we denature a toxin producing bacteria, and this denaturation can leave the antigen binding site, or the antigen or receptor binding site, so that it can stimulate and induce a humoral response. So simple: tetanus, diphtheria. Take the tetanus and diphtheria, denature them, and leave the receptor binding site, so it can generate the antibodies and toxins which can protect you from these tetanus and diphtheria. Again, tetanus, we in the ER we have to encounter a lot of patients with the tetanus accidents. And in subunit V vaccine, we we will link these bacteria with this vaccine category, that it is low side effect. So every human need papillomavirus, every human need hepatitis B, every human need Neisseria gonorrhea or Neisseria meningitis, every human need strep pneumo in order to attain specific protection from the viruses and bacteria. Then we have the killed viruses. These one: rabies, a dog bite case; typhoid fever; hepatitis, oral hepatitis from the trip or from a daycare center; then polio in our developing country; influenza. So if you think about these all viruses and their pathogens and their importance, then we don't need to memorize all these. We just go a quick thorough review over these, try to link those things, and that's all. It all get memorized in our long-term memory. So this is all about vaccinations.